The average healthcare provider office fields thousands of calls, faxes, and emails a day to provide care for incoming and outgoing patients. The problem is medical providers have no effective way to communicate their schedules with each other. In other words,
it's as if the quarterback had to run a play, but he couldn't see. So he's essentially throwing footballs. He doesn't know if they got where they need to go, and he never knows.
This is John. He's one of the guys behind Blockit. So why is it important for physicians to see what happens next to their patients?
A lot of times when they are discharging patients, that's not the end of their care. They actually need to go.
This is Jake. John and Jake are just a few of the people on the team of researchers, developers, and healthcare professionals behind Blockit.
They need to go see an orthopedic doctor because they broke something. They need to go see a cardiologist because they had a heart issue, whatever it is. 46% of the time, they're not getting to where they need to go because the coordination wasn't done well.
Think about it for a second. No, seriously, look at me. There are patients sitting at home right now waiting for appointments, while local doctors are sitting in their offices waiting for patients. What if, instead of the hours and hours of phone calls, faxes, and emails, discharge advocates could simply pencil in their own patient in another physician's available schedule?
The solution already exists. It's just not been enabled. We're enabling something that exists right now.
Healthcare professionals can continue using the systems they're familiar with, while this integrated platform enables their established systems to communicate with one another. Putting a piece into a puzzle isn't hard. Figuring out where that piece goes, that's hard. And that's what Blockit is doing. New information such as eligibility, referral patterns, and proximity to the provider will help see where the patients best fit. With Blockit, providers will be able to track each of their patients' care journey in real time. And with an automated decision tree, physicians can make sure the right patient gets to the right provider in the right place at the right time.
All of the things that go on outside of helping that patient get better effectively gets automated and uses digital technology to orchestrate it. Whether that's him or her doing that alone, or whether there's 20 providers who are all coordinating to help that patient get better. That's all that they should have to focus on.
This is a game changer, especially for the care of the low-income and uninsured people in your community.
As we kind of looked at, well, what are we really trying to do? What are we really trying to build? Charging a nonprofit clinic who's taking care of people for free really doesn't play into our mission at all.
Because we're serious about our passion to actually begin improving patient care, we will be offering our services free of charge to all charitable clinics. This means doctors can remain in their offices while indigent patients are worked right into their normal workflow. Blockit removes the unnecessary barriers between the providers and their community of patients.
Our perfect business scenario, all of a sudden you go to your primary care provider and they say, hey, you need to see a cardiologist. Are you free tomorrow at 2 p.m.? I'm gonna send the invite to your phone. Then you smile because that's Blockit.
That's healthcare reform. And we think it's about time.